Hello, my name is William Kearney, and today I'm going to do my video discussion on solution-focused brief therapy or narrative therapy. First, SFBT, which is solution-focused based therapy, is a future-oriented, goal-directed approach to solving human problems of living. The narrative therapy is a strength-based approach that emphasizes collaboration between the client and the therapist to help clients view themselves as empowered and living the way they want. Both are similar in the fashion that they are social construction models. They both serve a purpose in counseling. The purpose in counseling, which helps the client to change the way he or she thinks, not how they behave. Both avoid modernist views of language, which presumes that the language represents internal mental constructs. Instead, they operationalize a postmodern view of language in which language constitutes social reality. Both can become integrated as the therapist and the clients are collaborators in developing a solution-oriented narrative framework for reauthoring processes of the client's life. They differ to the fact that in solution-focused brief therapy, the SFBT, clients choose the goals they wish to accomplish. Little attention is given to diagnosis, history taken, or exploring the emergence of the problem, whereas the narrative therapy encourages its clients to use greater depths of cognitions with the focus on the initial problem. Some of the strengths and limitations of each theory is a strength of the SFBT. Instead of putting time and effort and focusing on the client's problem, SFBT is grounded on the optimistic assumption that people are healthy and competent to have the ability to construct solutions that can enhance their lives. A weakness or limitation of the SFBT is that if a client wants to focus on the negativities of their life issues, SFBT is not structured in that fashion, but instead the SFBT highlights solutions. The strength of the narrative therapy is it focuses on the client's understanding of his or her own story and how the client's emotions, actions, and problems fit into the context of the story. The narrative therapy allows people to not only find their voice, but to use their voice for good, helping them to become experts in their own lives and to live the way that reflects their goals and values. A weakness or limitation of the narrative therapy is since the therapy itself changes the client to client. It changes from client to client. There is little evidence-based research done. Since narrative therapy views the client as an expert of his or her own life, in many occasions, diverse clients may expect the therapist to act as the expert instead of having to conduct the conversation themselves. For this reason, narrative therapy can be challenging when the individual is not articulate. Lack of confidence, intellectual capacities, and other issues could also undermine the expression of the individual through a narrative. What are some of the ways that each theory is compatible and incompatible with Christian concepts? Is compatible, just as a solution-focused philosophy and narrative therapy rest on the assumption that both theories can become integrated as the therapist and the clients are collaborators in developing a solution-oriented narrative framework for the reauthoring process of the client's life. The Christian concept would agree that Christ is the reauthoring of our lives. As the author God is in complete control of our lives. He knows the beginning. He knows how it is going to end. He knows what needs to be placed in our lives to entangle that knot of sin inside of us, to make us more like His Son. He brings other people alongside of us. The incompatibility of narrative therapy and the SFBT is incompatible with Christian concepts in that both therapies are strength-based approaches that emphasize collaboration between the client and therapists to help clients view themselves as empowered and living the way they want to live. As a Christian, someone who has put faith and trust in the redemptive work of Jesus Christ through His death on the cross and subsequent resurrection, our behavior mirrors, reflects, and resembles Christ. Now, based on each theory, concepts of psychopathology, in discussing any limitations as far as creating measurable outcomes for clients. Measurable outcomes for the client. Both therapies reject the use of pathology and the use of diagnosis. The solution-focused brief therapy can't help with everyone, because some clients want to talk and go over their past issues for answers. And this therapy assumes that all clients are capable of solving their own adversities, which all clients are not capable of solving their own adversities. The narrative therapy has no set program or formula that the therapist can follow to guarantee a desirable outcome. Thank you for your time, and you have a great day.